Dawn Butler.
Thank you, Madam Deputy Speaker. I beg to move that leave be given to bring in a bill to make provision about the use of the title of nurse and for connected purposes. Madam Deputy Speaker, I'd like to thank the Minister for Health for being here for this debate, and I'd like to thank the incredible #ProtectNurse campaign led by Professor Alison Leary, MBE, and Paul Trevat, as well as nursing organisations such as the Queen Nursing Institute, the Institute for Health Visiting Charities, Unison Health, Unite, the Royal Colleges of Nursing, Professional Nursing Committee, as well as many other people and groups all supporting this change. So I'm honoured to be working on this for so many years, and my bill today is about protecting the public and respecting the training and qualifications and experiences of registered nurses. Now, I'm sure it would come as a shock to many people here today and watching this that anyone can actually call themselves a nurse. They can print out a business card and they can start work, and that would be fine. That's currently legal. Even those who have been struck off the Nursing Midwifery Council for registered for serious misconduct or have a criminal conviction can continue calling themselves a nurse. And Madam Deputy Speaker, this is unacceptable and is actually quite dangerous, because when you hear nurse, you automatically think somebody's qualified. You know, I'm sure we've all done it. Somebody says they're a nurse and you say, can you have a look at this rash for me? Or, you know, I'm feeling a bit of pain in my left side. And you start giving personal information because you trust them. You trust the title of nurse. And I think it's about time that we show the nursing community just how much we value and appreciate their qualifications, because we know how important nurses are in society. We clapped for them during COVID. They were on the front line. They saved many people's lives. So I think this change, Madam Deputy Speaker, is well overdue. And when I think about nurses, I also think about my cancer nurse, Amy, and I think about how amazing and special she is. So this bill and this campaign is also a tribute to her. I tried in 2021 to put an amendment to the Health and Care Bill, which received support of 240 MPs. It's an enormous amount of support, and we thought we were going to get it over a line, but it was a shame that the last Conservative government used their majority to vote it down. But now we have a Labour government. I am really hopeful and confident that we will be able to amend this law to protect the title of nurse, because at the end of the day, the first role of a government is to protect its citizens, and I think this will go some way in doing that. A Freedom of Information request by Nursing Standard found that 93% of all NHS trusts had more than 8,000 people using the term nurse in their job title who in fact had no registered nursing qualifications. This is worrying, and it is just incredible when you think about the figures and the numbers. So we know the problem, and so what's the solution? The solution is quite clear. The simplest way to rectify this is to amend the Professional Qualifications Act, adding nurse to registered nurse, which is already regulated by the Nursing and Midwifery Council, and so would not need to be part of regulatory reform. So that's all we have to do. And importantly, we've done a lot of work and research with lots of professionals. My bill will recognise existing and protected titles such as veterinary nurse and dental nurse, so that would not be affected. Madam Deputy Speaker, the Royal College of Nursing, the RCN, passed a resolution in favour of protecting the nurse title at its Congress in 2022. Those in the profession know exactly what must be done, and we cannot wait any longer to do it, because we know how dangerous the current situation can be for patients. Cassandra Grant, 39, a dangerous fantasist who posed as a nurse at the Blenheim Palace horse trials, jailed for 4 years. She was involved in injecting an injured rider. She repeatedly lied about having medical and mental health qualifications, and the judge said it made his blood run cold to think of Grant getting her hands on a patient. Kate Shemirani was a nurse who claimed 5G caused COVID symptoms and spread vaccine misinformation. She was struck off, but she was still able to call herself a nurse and was legally able to do so. Lee Woods, A 28-year-old man was arrested and charged in connection with impersonating a member of the nursing staff at Queen Elizabeth University Hospital in Glasgow. Madam Deputy Speaker, I could unfortunately go on and on and on of cases where the title of nurse has been exploited in this way. So it's really important that we legislate. And building on the hard work of the hashtag Protect Nurse, I hope that the Labour government will now be able to improve this legislation. The Labour government has made great strides since taking office in rebuilding our NHS after 14 years of current and consistent neglect. Now, I urge the government to support my bill as part of this vital package of reform and help bring about this simple, common sense and long overdue change for nurses and patients. With overwhelming backing of those in the profession and a growing public concern, Madam Deputy Speaker, now is the time for this change. I have been in this House, first elected in 2005, seems like a lifetime ago, and I'm here to represent my constituents of Brent East. It was Brent South, then Brent Central, now we're Brent East with all the boundary changes. And I think this is one of the most important bit of legislation that can change everybody's lives, make nurses know that we appreciate them, make patients know that they can have confidence in people who call themselves a nurse. And it's a very simple and easy step. Madam Deputy Speaker, I move.
The question is that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
Paulette Hamilton, Tulip Sadiq, Miss Sharon Hodgson, Barry Gardner, Juliet Campbell, Clive Lewis and myself.
Dawn Buckler.
Nurse Use of Title Bill.
Second reading what day?
Friday the 28th of March.
Friday the 28th of March. Programme.